Joining. It's so nice to see so many constituents here. My name is Veronica Meach. I am the Grassroots Advocacy Director for the Alzheimer's Association, which represents the Central Coast area. I want to thank you all for joining us today as we come to the close of what we know as Alzheimer's and Brain Awareness Month, which happens every June. To honor this month, we are so proud to be led by our co-hosts, Assemblymember Don Addis and Assemblymember Gail Pellerin. Both Assembly members Addis and Pellerin have been eager to offer this event year after year, which showcases their understanding that building broader awareness about Alzheimer's and dementia will really ensure that our community seeks access to the needed care and support services in a timely manner. So today we'll begin with remarks from our two legislative champions, and shortly after that, we will learn from our volunteer expert, Barbara Rhodes, about supporting brain health in our community. And then finally, we'll give everyone an opportunity to ask your questions so that we can have a live question and answer session. A couple of housekeeping items are just please, if you have questions throughout the session, remember to use the chat feature and we'll get to those at the end of the event. And the recording will be emailed to all of you so that you can revisit the information as needed. Now, I would like to thank Assembly members Don Addis and Gail Pellerin for their partnership in hosting today's event. Assemblymember Addis represents California's 30th Assembly District, which includes large portions of San Luis Obispo and Monterey counties and the southeastern area of Santa Cruz County. Assemblymember Gail Pellerin represents California's 28th Assembly District, which includes portions of Santa Cruz and Santa Clara counties. Both have been steadfast partners of the Alzheimer's Association, so I would like to thank you both personally for that. You've supported our priority legislation, you've attended our walks to end Alzheimer's in the community, and you have been here with us supporting community education. So thank you very, very much for all of that ongoing partnership. And with that, I'd like to hand it over to Assemblymember Addis to get started.
Well, thank you so much, and good morning. And it's wonderful to be here with my partner in crime, Assemblymember Gail Pellerin. We get to share Santa Cruz County representation together and really the entire Monterey Bay region that we call home. So I'm very proud to get to represent Santa Cruz, Monterey, and San Luis Obispo counties in the state legislature. And I'm honored to be back for my third time for Alzheimer's Association and making sure that we are sharing quality information out to Central Coast constituents, and of course, to be here today for Brain Awareness Month. We've in the past talked about communication for caregivers as well as the 10 warning signs, and I just think it's vital that we're talking about brain awareness and brain health. And so let me also say thank you to the Alzheimer's Association, to Jordan Berg and Barbara Rhodes from right there in the Monterey Bay, and of course to Veronica, who's chiming in from Sacramento. I think that most everyone here knows that we have millions of people over the age of 65 that are living with Alzheimer's and dementia. That's 1 in 9 people, or 7.2 million Americans over 65 that are living with this disease, and almost 1.4 million caregivers and family caregivers who are involved in caring for loved ones with Alzheimer's. And so this is truly one of the most pressing issues for Californian families. And want to say again how much I appreciate the work of the Alzheimer's Association. We were talking just before going live about how active the Alzheimer's Association is in terms of fighting for legislation, fighting for budget action, and making sure that we're uplifting Alzheimer's for the true issue that it is for California's people. So I thought I'd share just a tiny bit about legislation that has passed in the last couple of years. We did extend the California Alzheimer's Disease and Related Dementia research voluntary tax contribution. And if you're so inclined, next time you do your taxes, you can look for that on your forms. We also updated the Alzheimer's and Related Disorders Advisory Committee to expand it and create more equitable representation here in California. And this year, we're working on a Senate Bill 950 that would make sure that health plans and insurers are covering FDA approved medically necessary treatment and medication for Alzheimer's and related dementia. And I say all this because I think each of these pieces is vital when we think about brain awareness, the education, the policy, and the resources that we can be putting behind brain awareness and Alzheimer's understanding and research and cure here in California. We know that the most important things we can do are to be preventative of brain disease and protective of brain health. So I want to make sure I'm committed. I know Assemblymember Pellerin is committed to making sure that we continue the waves of change that we have made in Alzheimer's research, care, education, and ultimately cure, particularly by supporting brain health in our communities. So I want to say thank you to each and every one of you for spending your time on a Friday morning to learn about this important topic. And with that, I will turn it over to my good friend and colleague, Assemblymember Pellerin.
Thank you, Assemblymember Addis. That was a great update. I really appreciate that. And good morning, everyone, and welcome. And also, Assemblymember Addis is such a champion for healthcare. She's the chair of our subcommittee on health, and she's just been working tirelessly to fill that gap that we're seeing due to the federal government cuts, and just really such a champion and a warrior for affordable healthcare in California. So thank you for all of your work. And thank you all for joining us for our annual Alzheimer's education event in recognition of Alzheimer's and Brain Awareness Month. I appreciate each of you taking the time out of your day to learn more about brain health and how we can better support those living with Alzheimer's disease and other forms of dementia. For me, this issue is deeply personal. My father-in-law, Dan, is 96 years old and has Alzheimer's disease. And over the years, our families had watched the disease gradually take pieces of the man we've always known and loved. Alzheimer's doesn't just affect the person with the diagnosis, it touches every member of the family. It changes conversations, routines, relationships, and the role loved ones have played. Certainly, our loved ones are playing the role as caregiver. But through it all, we've also learned something important. Even as memories fade, moments of connection still matter. A familiar smile, holding a hand, sharing a favorite song, or simply being present can bring comfort and joy. I recently was with my father-in-law, and he just was in a mood to sing, and we sang lots of songs from his memory, and it was just such a beautiful moment. And those moments remind us that that person we love is still there, deserving of dignity, compassion, and connection. And as our population ages, more families across California are finding themselves on this journey. Here in Santa Clara County, there were 80,000 people over 55 living with Alzheimer's disease. In Santa Cruz County, there were 12,000 people over 55 living with Alzheimer's disease. And by 2030, we're expecting 1 in 4 Californians 65 and older. And in Santa Cruz County, that number is expected to jump 1 in 3. And right now, 30% of our total workforce is at least 55 years of age. So the more we understand brain health, recognize the early signs of cognitive decline, and know what resources are available, the better equipped we will be to support our loved ones and our communities. I'm grateful to everyone who's helped make today's webinar possible. Thank you so much to Veronica and Jordan, and especially to our presenter, Barbara Rose. We're looking forward to you sharing your expertise and guidance, and I hope today's discussion leaves each of us with greater understanding, practical tools, and hope. So thank you again for having me here today. It's a great pleasure to be here and to learn myself about what we can do to support our brain health in our community. Thank you so much.
You so much, and thank you so much to both Assemblymember Addis and to Assemblymember Cullen for your warm remarks and just the incredible support of our mission. We are so grateful to both of you for being ongoing champions for those affected by Alzheimer's and all other dementia. Uh, Hello, everyone. My name is Jordan Berg, and I am the Community Engagement Specialist for the Alzheimer's Association here in Monterey, serving all of Monterey, Santa Cruz, and San Benito County regions. I am very pleased to introduce our presenter for the day, Barbara Rhodes, who will be offering our presentation on supporting brain health in our. Before we get started, as a reminder, if you have any questions, please feel free to enter those using the chat feature, and we will offer a Q&A session at the end of the presentation. So our presenter today is Barbara, and Barbara is a retired nurse practitioner who was a lead provider in a memory evaluation center for many years. She now volunteers as a community educator, as an advocate, and as a co-facilitator for support group in Santa Cruz for the Alzheimer's Association. I'm very pleased to hand it over to Barbara now to start our presentation.
Thank you. Thank you, Jordan. And thank you, Assembly members Pellerin and Addis, for sponsoring this education event. Let me go to my presentation. Share my screen. From the beginning. There we go. Okay. So today's presentation is about supporting brain health in our community. It is designed for all ages, not just for those that are in their senior years. So I'm hoping that there's some parents in the audience or young adults, because supporting brain health is so important in preventing dementia. And so starting the efforts at a younger age is the focus of our efforts here. I volunteer because I was professionally a nurse practitioner in a memory center, and I have family members that had dementia, and I saw the impact both in the clinic and in my family about dementia and how it affected all our relationships. My mother-in-law, my mother, both had different types of dementia, and the ability to enjoy their last few years was completely affected by the dementia that they had. So that's why I'm committed to educating both the public in various ways about how to prevent dementia and just more information about it. Assembly members Pellerin and Addis gave you some statistics about Alzheimer's disease. Here's some more, and you can see that, for instance, in this year, 2026, Alzheimer's and other dementias are going to cost the nation almost $500 billion. And in 25 years, it will be $1 trillion if we don't make headway into this terrible disease. There are 3 out of 4 people, Americans, say that lifestyle behaviors are important to brain health. And I'll talk in detail about those today. But not even half of them strongly connect these behaviors to reducing dementia risk. So that's what I want you to take from today is the impact that you have in preventing dementia and cognitive loss. The numbers are overwhelming because behind every statistic is a real person, a real family, a real story. Over 7 million Americans are living with Alzheimer's today, so 7 million lives are forever changed. Nearly 12 million people, spouses, children, friends, are providing care not for a paycheck, but out of love. They give their time, their energy, and often their own health and well-being to take care of their loved ones. Alzheimer's is not just a disease of memory. It's a disease that steals futures. It's one of the most expensive conditions in our society, draining families emotionally and financially. If we don't act, the toll will only continue to grow on our healthcare system and our communities. My hope is that you leave today not just informed, but inspired. Inspired to share what you've learned. Inspired to take action. Action for your brain health and the brain health of your family. Inspired to support someone who's struggling. And inspired to stand with us in this fight for a world without Alzheimer's and all other dementias. Now let's go over some definitions so that we're all on the same page. Cognitive decline refers to changes in memory, thinking, and other reasoning that worsen over time. Just as with our physical abilities, some cognitive decline is expected as we age, of course. Not everyone with cognitive decline has dementia. Some causes of cognitive decline are reversible. Dementia, on the other hand, is not a single disease. It's an umbrella term, like heart disease, that covers a wide range of conditions that affect memory, thinking, language, problem solving, and even personality. These changes are serious enough to interfere with daily life and independence. They don't just affect the person living with dementia. They ripple out to families, relationships, and entire communities. Alzheimer's is the most common cause of dementia, but there are other causes too. In my practice as a nurse practitioner in a memory center, the most common diagnosis was the bottom one, mixed dementia, usually from Alzheimer's and vascular dementia. It's actually quite uncommon to have purely Alzheimer's, much more likely to have more than one type at the same time. Most people are not really aware of that. When concerns about memory or cognitive changes arise early, detection is so important. Early detection isn't just medical, it's deeply personal. It's about giving people the best chance to live fully with dignity and support. When Alzheimer's is caught early, there's a chance to make lifestyle changes that may help protect brain health. Things like managing blood pressure, quitting smoking, staying physically active, and keeping the mind and heart engaged through social and mental activities. It's not just about medication. If it was just about medication, we would have had medication available way before now. Getting an early diagnosis can also bring peace of mind. It helps explain what's happening and gives families a chance to plan, connect, and make the most of their time together. It also opens the door to support programs, resources, and a community that understands what you're going through. You are not alone in going through this experience. We are here with you. Make an appointment with a doctor or other healthcare provider if you have concerns about yourself or someone you care about. There is real hope on the horizon. For the first time, we're seeing treatments that can do more than manage symptoms. They're actually changing the course of Alzheimer's disease. We call this the era of treatment. The U.S. Food and Drug Administration, the FDA, has approved several medications that fall into two key categories. Drugs that temporarily ease symptoms like memory loss and confusion. They've been around for more than 30 years. Anti-amyloid drugs that target the disease by removing beta amyloid from the brain. Clinical trial participants who receive these anti-amyloid treatments experienced a reduction in cognitive and functional decline, meaning these treatments slow disease progression. These anti-amyloid treatments are appropriate for people with mild cognitive impairment or mild dementia stage of Alzheimer's disease, and who also have evidence of a buildup of amyloid plaques in the brain. This is one of the reasons why early detection is important. These new treatments are pivotal, though not a cure. Today, there is a worldwide effort underway to find better ways to treat the disease, delay its onset, and prevent it from developing. When it comes to any treatment, it's important to talk with a healthcare provider. They can help you decide if a medication is the right choice and explain the possible benefits and risks, because there are risks associated with this new category of medication. If someone starts a treatment for Alzheimer's, they should be monitored by a doctor who knows how to use these medications. That way, they can get the right support and make informed decisions about their care. Also, to avoid side effects or drug interactions, it's really important that the doctor, pharmacist, and care team know about all the medications being taken, including over-the-counter drugs, vitamins, and herbal supplements. We would have people bring all of their prescription and non-prescription and supplement bottles into the clinic where a pharmacist would check them to make sure there were no interactions, you were not doubling up on one type of medication. That's how important it is. The association believes that everyone deserves to live their life with the healthiest brain possible. So let's look at the risks to brain health. There are many. Some, like age, we can't control, but there are actions we can take to help improve our brain health. Controlling certain health conditions and building more healthy living habits can make a difference. This is true even for people with a family history of dementia. Every step we take toward healthier living is a step toward a healthier brain. These are the 10 healthy habits for your brain. This is a list put together by the Alzheimer's Association, and we'll go over them one at a time in detail. What's good for the heart is good for the brain. Many of these habits, like eating right and getting moving, also reduce the heart disease, stroke, and some cancers. Brain health is important at all ages and stages. From childhood through older age, it's never too early or too late to take action for brain health. Taking care of your brain health can help you feel better now and help protect your memory and thinking when you're older. Many of these habits have ripple effects on others, like exercise can help you sleep better and help control diabetes and blood pressure. And the more habits, the more benefits for brain health. Let's take a closer look. Hypertension and diabetes are risks to brain health. It's important for people to monitor both and work with a healthcare provider to keep them controlled or prevented. For both, medications can be effective, and other healthy habits like healthy eating, being physically active, and getting quality sleep can help too. For blood pressure in particular, there is good evidence from randomized controlled trials of diverse populations that treating high blood pressure is a pathway to reducing cognitive impairment. Systolic blood pressure, which is the top number, should be under 130. Having high blood pressure might not have any obvious symptoms. In fact, it's called the silent killer. So people might not be aware their blood pressure is high. It's important to know your numbers and take any needed action to control them. We all know that physical activity and balanced nutrition are good for our overall health, and this includes our brains. Eating right and exercise can have a positive effect on the size of our brains. Get moving. Building more movement into your day, especially aerobic or cardio activity, is key. Find what works for you. Going for a swim, getting off the train a stop further away and walking the rest of the way, choosing a parking spot that's not right next to the store you want to go to, dancing with your kids, going for a walk with a neighbor. Eat right. And we know balanced, healthy eating is good for the brain. This includes key themes from well-known healthy diets like the MIND diet, the Mediterranean diet, and the DASH diet, such as eating lower fat and less processed foods, and more vegetables and lean proteins, swapping in some healthier options or how you cook, like using olive oil instead of butter, can help you still enjoy your favorite foods or foods that are important to your culture, but in a little bit healthier way. Maintain a healthy weight. Healthy weight is connected to a lot of the habits we've seen already. Midlife obesity is a risk to brain health, in particular midlife obesity. So maintaining a healthy weight earlier in life and throughout adulthood is important. Weight is complex and should be discussed with a healthcare provider to see what is best for you. Sleep well. This is about getting good quality sleep regularly. These are things that we are able to control, like creating the best sleep environment possible for ourselves. Sleep-related problems like sleep apnea can affect brain health, and these need to be addressed with a healthcare provider. I have more than a few times ordered sleep studies when I worked in the Memory Evaluation Center. That's how important it is. I shouldn't have to say it any longer. No one should, but be smoke-free. We all know smoking is not good for us, and that applies to our brains. The good news is that for people who quit smoking, the risk of cognitive decline lowers back over time to levels similar to those who have not smoked. Protect your head. Brain injuries increase the risk of developing certain forms of dementia, and repeated head injuries may increase risk even more. If you experience a head injury, don't overlook it. Talk to a healthcare provider. Children and older adults are at greater risk of falling. Do what you can to prevent falls and injuries. Stay in school. Formal education is a protective factor for brain health, and the more schooling, the better. The theory is that we build up a cognitive reserve like a bank that we carry with us into older age. We are continually learning as children and need to keep doing so as adults, which leads us into the next one. Challenge your mind. Be curious. That font should be larger. Be curious. When we talk about cognitive engagement, it's really about challenging your mind and making your brain work. The key is the activity needs to be complex and challenging or include new ways of thinking. This will be different for everyone. Try learning a language or a new hobby. Once activities become routine or too easy, like those games maybe you play on your phone, or the Sudoku that you do, or the crossword puzzles, once they're too easy, it's time to add something new and level up the challenge. If you're struggling, you're working your brain, and that's what you need to do. Why are these the 10 habits? The evidence around brain health risk factors is continuously evolving. Because of that, the association continuously monitors the evidence and draws conclusions based on published studies and reports. Right now, these are the 10 areas that have the strongest levels of evidence. So that is what is included in our 10 healthy habits. As I mentioned, the science continues to evolve. Just because a risk factor is not listed here does not mean it has no influence on cognitive decline and dementia. There is a lot of exciting research being done in the areas of hearing and vision loss, stress, and air pollution, for example. For now, focusing on these 10 is the priority. You can learn more at the Alzheimer's Association website, alz.org/healthy habits. The 10 healthy habits showed us that many health behaviors and conditions can affect the risk of cognitive decline and dementia. And now we have evidence that doing something about them can have a positive impact on brain health. The U.S. Pointer study showed that a program combining exercise, nutrition, cognitive engagement, and health monitoring can meaningfully protect brain health. So this is not just general advice that you might hear about taking care of your health. We have evidence. This was a randomized controlled clinical trial, the best format for evidence, that tested 2 lifestyle interventions in a large, diverse population of older adults at risk for cognitive decline and dementia. Participants were either a self-guided or structured lifestyle program. Cognitive function improved for both groups, but the structured group showed the greatest benefit, performing at a cognitive level compared to adults nearly 2 years younger. This is a very important study that underscores the message that healthy behaviors have a powerful impact on our brain health. You can see here the brain health recipe that the structure group followed. The U.S. Pointer study showed that brain health recipe involves a balanced exercise routine that includes 30 minutes or so of aerobic exercise, like jogging or dancing or walking fast or hiking, that really gets your heart pumping 4 times a week, along with stretch and resistance exercises, lifting weights, for example, and stretching and balance activities. Having blood pressure, blood sugar, and weight regularly checked by a healthcare provider, following the MIND diet, which is a combination of Mediterranean and DASH diet, including eating dark leafy greens, berries, nuts, whole grains, olive oil, and fish, and limiting sugar and unhealthy fats. Regularly exercising and challenging the brain. Remember that what we do every day can make a real difference in protecting our brain health. The U.S. Pointer studies show that we can take charge of our brain health. It is never too early or too late to start. Remember the 10 healthy habits for your brain and the U.S. Pointer brain health recipe. And think about what you can do to build more brain healthy habits into your daily living. Now, these are some of the ways that the Alzheimer's Association can assist. The free 24/7 helpline is a free service offering 24/7 help for those caring for someone with dementia, someone living with dementia, or you're just looking for some answers. They're master's trained clinicians that can help you if your loved one wakes up at 2 a.m. and says, "Help me get ready, I need to go to work," and they haven't worked for 30 years. What do you tell them? You don't say, "You haven't worked for 30 years. What are you talking about?" You say, "Well, it's dark out now. It's very early in the morning. I'll help you get ready for work at breakfast, after breakfast time." And then they go back to sleep and they will have forgotten by the morning. So these clinicians on that 24/7 helpline, 800-272-3900, again, 800-272-3900, can help you with figuring out what to do, can help you find a support group, can help you figure out what might be the best living situation for your loved one. Trial Match is the association's assistance in finding a clinical trial that can match you with efforts to improve caregiving or around treatment or around diagnosis. There's also a site called clinicaltrials.gov, clinicaltrials.gov, which can help match you to a clinical trial in your area. I would strongly advise that whoever is interested in furthering the knowledge and research that we have around dementia sign up for a clinical trial. It's been said that one of the reasons why we haven't gotten further in preventing or treating dementia is because there aren't enough people signing up for clinical trials. So I encourage you to do that. For caregivers and those living with dementia, to help fuel our mission, we engage volunteers at every level of our organization and raise funds to support our efforts. Often our fundraising efforts are the entry point for individuals to volunteer with the association. You've probably heard about the Walk to End Alzheimer's. It is the world's largest fundraiser for Alzheimer's care, support, and research. The event calls on participants of all ages and abilities to join the fight against the disease. It's always in the fall, and there is one in Santa Cruz area and one in Monterey. It's actually a very joyful event. And there's a lot of energy, positive energy at these walks. So I encourage you to attend. Do What You Love to End Alzheimer's is a personalized fundraising initiative by the Alzheimer's Association that builds on the success of their previous event. Perhaps you've heard of The Longest Day. This new campaign invites people to turn their passions into purpose by choosing any activity they love, whether it's baking, biking, painting, gaming, or anything else, and using it to raise funds and awareness for Alzheimer's and other dementias. Act now. Support the ASAP Act. I want to share a major opportunity for you to change the course of Alzheimer's in our community. Researchers have developed simple blood tests that can detect Alzheimer's before symptoms even appear. But there's a catch. A legal barrier currently prevents Medicare from covering them. As too many of you know, getting a diagnosis takes too long, and less than 10% of people ever do. That is a travesty. And they may miss the chance to get treatment. But this is our mammogram moment. Just as routine screening transformed breast cancer outcomes, the bipartisan ASAP Act will make early detection the standard for Alzheimer's. It doesn't mandate coverage. It simply clears the legal roadblocks so Medicare can provide it. But we need your help to get this across the finish line. You don't need to be a policy expert or a scientist. You just need to share your story. Stories are powerful, and they move your legislators. Your voice is the only thing that can turn this scientific milestone into a reality for millions. Scan this QR code to send a message to Congress. Take a moment to edit the email that you'll get with your personal story. You have the power to help us move closer to our vision, a world without Alzheimer's and all other dementia. The Alzheimer's Association offers a wide range of volunteer opportunities to match every interest, skill set, and schedule. Whether you're passionate about advocacy, education, event planning, or simply lending a helping hand, there's a place for you. By sharing your time and talents, you can make a meaningful impact in your community and connect with others who share your passion for making a difference. Whether you want to get involved on your own, with a service club, your workplace, or a group of friends, we'll help you find the role that fits. That's the right fit. And if you're here today because someone you care about is affected by Alzheimer's, know that we're here for you too, with support, resources, and a community that understands. Today, we can create change. To learn more or get started, reach out to the Alzheimer's Association. Thank you. I'm now ready for any questions that may have shown up in the chat, if there are any.
Wonderful. Thank you so much, Barbara, for such a great presentation. Very informative as always. And this is an opportunity for anyone who would like to ask any questions. If you can please enter any questions into the chat, we'll read those out to Barbara. I'll start with one that has come in about opportunities to challenge your mind. Lynn was wondering if reading books on from any source or any subject matter is a good way to challenge your mind.
Reading is definitely a good way to challenge your mind. But I would encourage you to branch out to other genres. If you like mysteries, murder mysteries, I like reading murder mysteries myself. Branch out into sci-fi, branch out into biographies, challenge your mind. The idea is that you don't want to stick to a strict routine with whatever you're doing. You want to present something new to your brain so that it has to process it and think about it and work it out and maybe even problem solve. So I would encourage you to absolutely read. It's a very good pastime, but branch out into other areas so that you're challenging your brain a bit more.
And Barbara, in your opinion, what is the most recent, most promising research being done on Alzheimer's and dementia?
I didn't quite get that. What is the most recent?
Most recent and most promising research being done around Alzheimer's and dementia?
I would say, this is an era right now of research, exploding research around dementia. There are two areas. I'm not going to be able to choose one. The two areas are the advent of monoclonal antibodies, which is the category of anti-amyloid medications, which will also roll out into anti-tau medications, which is also a protein that builds up and causes damage. So the advent of these new medications is startling to the brain, the dementia community. The other is the possibility of finding out early whether you have dementia. Now, finding out whether you have dementia through these blood tests, which we're hoping Medicare can cover with once the ASAP Act is passed, and we're putting a lot of effort into getting that passed. But once we find out whether we may be at risk or have the biomarkers for dementia, what do we do then? That's where the monoclonal antibodies and the medications to follow will be available, and we'll have access to it. So it's so those two areas of research are what's most exciting right now.
Could I also just jump on to the end of that, Barbara, to add that for any of you who are interested in learning what the latest in research is, the Alzheimer's Association does put on the largest international conference for research, which is called AAIC. It is something that is a large in-person conference, which can be costly to attend, but we now offer a virtual option, which is a half day. And I'm going to put a link in the chat. It's called AAIC for All, which is the virtual free community option where you can learn some of those really cutting edge pieces that typically have, I think, a high interest among kind of the average folks like us who just want to know what to expect in our doctor's offices or in the media. So I'll put a link there. You're welcome to register. It's completely free. And even if you can't join on the day that's advertised, I'd highly recommend that you still register because you will have access to revisit that content for up to a month following the event.
Yeah, it is an excellent presentation. So I would thank you for mentioning that, Veronica. Yeah, I would definitely avail yourself of that resource.
Question here. Does meditation or mindfulness practices help with cognitive elevation and reducing the risk for dementia?
Mindfulness practices, I can't say too much about them. Wonderful, wonderful practice as far as stress management, as far as being able to be in the moment. For instance, mindful walking is a way to prevent falls. Mindful eating is a way to eat healthy. Mindfulness practices, for instance, Tai Chi or meditation, excellent way to be in the moment, to kind of quiet a brain that is surging and can't quite calm down. I would highly recommend mindfulness practices. And in fact, there are clinical trials around mindfulness practices for brain health. How does it impact your risk for dementia? So thank you for asking that question. Definitely recommend mindfulness practices.
Good. Yep. And Veronica, I'll direct this question to you. Someone had asked if you could clarify a bit more about the tax exemption for volunteers that Assembly Member Addis had mentioned in the beginning.
Oh, yes. Happy to do that. So, a couple years ago in California, for many decades, we've had what's called a tax checkoff. So it's not a tax exemption, but when you file your tax return, if you are eligible for a refund, you do receive the option at that point to check a box and select how much you'd like to donate for Alzheimer's specific research. And that was something that was about to go away on tax refund forms. But 2 years ago in the legislature, we ran a bill to extend that. So you still, come tax season, you still have the option, if you are eligible for a refund, to select that some of those dollars do get funneled into California specific dementia research.
Question here, Barbara. Can you speak a little bit to the genetic factor to Alzheimer's? If, for instance, if one's parent or sibling were to have Alzheimer's, does that increase your risk?
I always get this question whenever I have a presentation. There are two aspects to genetics as far as dementia risk. There are the risk factors for diabetes. If you have diabetes in the family, if you have heart disease in the family, if you have high cholesterol in the family. So those are the genetic risk factors for those diseases, which can impact dementia significantly. And then there are the genetics around specific forms of dementia, like frontotemporal dementia or Alzheimer's dementia. But these, in particular, the Alzheimer's genetic risks are at a very young age, starts at generally around in the 40s, and is very small percentage of people have that type of genetic risk factor. It's more around hypertension, cholesterol, diabetes, these kind of things. But it is more likely that if you have one or two family members that you're more likely to have dementia. And generally, it's related to those other conditions. So small percentage of people might inherit those other types of genetic risk factors.
Thank you.
If that's
Another question is that we see a lot of brain health supplements or supplements that help with memory loss. Can you talk a bit about that?
I am happy to talk about that. Supplements are all about marketing. For instance, Prevagen, perhaps someone's heard of Prevagen. It's derived from jellyfish. It's taking that is like taking a multivitamin or multi-mineral supplement. The bottles have these great graphs on them with doctor this and doctor that. But the FDA has already forced the company to change the wording around slowing memory loss that they were using. So that's just one example. I would not put any faith in any of the supplements for memory. The only supplements that I might consider are those around certain vitamins like vitamin D, calcium, vitamin B12. If you're low in vitamin B12, that can affect your cognition and your balance and other things. And calcium and vitamin D are important for preventing falls. We checked vitamin D levels routinely. So those are important, but I don't have any faith, and the dementia care community does not have any faith in the memory supplements. So don't put any emphasis on that. And they're expensive.
Thank you. We'll take, I know there's so many questions, and we'll take one more here before we wrap up. Can you just speak a little bit more about what is the value of getting a diagnosis or knowing or taking the blood test if we know that there's not currently a cure for Alzheimer's?
Well, I would say there is no cure for Alzheimer's. This is true. If there is a cure or something that approaches that, it'll be it'll be attacking dementia, Alzheimer's in various ways. Much like when you get a diabetes diagnosis, you're taking at least three different medications right off the bat. But the value now is that you can avail yourself of the medications that we know can improve cognitive functioning for it's a new category of medication, so we don't really know, 5 or 10 years down the line, what it will have done for you. But this is the advent of an approach that can improve your quality of life and the ability to make some decisions, to avail yourself of resources if these medications are started. So I would encourage you to at least talk to someone about having, well, first of all, you should join the fight to get the ASAP Act passed. I mean, that's a given. And then talk to the Alzheimer's Association, your doctor, about the possibility of these blood tests, because the treatments now are rolling out, and you want to be able to have access to them once they're even more available. And like I said, it gives you the opportunity to plan for the future, to avail yourself of resources, and to join a community that can support you. So I hope that kind of addresses your concerns.
Well, thank you so much, Barbara, for taking the time to answer those questions and for your presentation today. We recognize there were many questions that we were able to get to. So if you still have a question afterward, we encourage you to reach out to our 24/7 helpline. I will put that into the chat again. That is at 800-272-3900. Please reach out to us. We thank you all so much for coming today. We are so appreciative of the support of both Assemblymember Addis and Assemblymember Pellerin in hosting this program today. And we hope to see you all at another presentation of ours in the future. Thank you all for taking the time, and we hope you have a great rest of your day.